This is the active and passive range of motion for the hip exam. So with this, you're going to take your large goniometer. Your patient will be sidelined to start for flexion and extension. So make sure that they're draped appropriately. And then you're going to place the center of the goniometer with the stabilizing arm going up the torso. We'll make sure that they're nice and straight on the table. And then you'll place the middle right where the hip hinges, so just up from the greater trochanter. And then you'll instruct your patient to bring their hip all the way up, and so they can bend their knee to do this. All right, you'll follow the measurement. You can go ahead and relax. Did you have any pain with that?
Nope.
Read the measurement from the goniometer. Reset for extension. Make sure she's in a nice 180 to start. Stabilize there. All right, and then you're going to just extend your hip back. Okay, and relax. Any pain with any of that?
Nope.
Okay, read that measurement. Then you'll flip your patient so that they're side lying on the other side, and you'll repeat flexion and extension. For hip AB and adduction, your patient will be supine. Make sure that the drape is still appropriate. Ask your patient to point to the front of the hips, so Carol can point to the front of your hips. So the center of the goniometer will be on the ASIS with the stabilizing arm going up the torso. So you'll hold that there, and then you'll instruct your patient to swing their leg out for abduction. Okay, and then any pain with any of that?
Nope.
Read the measurement. And then for adduction, you need to get the other leg out of the way. So you'll instruct your patient to pull their leg up and hold it. Set here, okay, and then can you bring this leg in as far as you can? Okay, and then any pain with any of that?
Nope.
Read the measurement. Move over to the other side and repeat AB and adduction. And then you're going to have your patient prone for internal and external rotation of the hip. Make sure that you move the headpiece for them and that you're putting the drape back appropriately. Okay, so you will, I'll do it on this side so that you can see. So you'll have their knee bent to 90. You'll have both arms of the goniometer facing straight up. And then you'll have the stabilizing arm staying stationary with the movement arm following the movement of the leg. So remember that in order, so if you're bringing the leg out, that's putting the hip into internal rotation. And if you're bringing the leg in, that's putting the hip into external rotation. So then you'll instruct your patient to do that. So Carol, can you bring your leg in all the way that you can? All right, any pain with any of that?
Nope.
Nope, come back up. And then, so that was external rotation. And then Carol, can you bring your leg out all as far as you can? Okay, and then come back in. Any pain with any of that?
Nope.
And then you just want to watch to make sure that the other hip is not coming off of the table to have them increase their range of motion. So if that happens, you can just redo it and ask them to keep their hip on the table. Then you'll switch to the other leg, and that ends the active range of motion portion of your exam. Now, while your patient is already prone, we can move into the passive range of motion. So again, I'm just going to take this here. And Carol, I'm going to move you through these ranges of motion, okay? So bring it to first Enfield. Any pain with that?
Nope.
Can I go a little bit further?
Yep.
Any pain with that?
Nope.
Nope. Okay. Switch your hand. Any pain with any of that?
Nope.
Can I go a bit further?
Yep.
Any pain there?
Nope.
And then again, make sure that you're looking to estimate how much more range of motion you have and write it on your clipboard. Then you'll switch to the other side. And then Carol, can you go and lay on your side for me, please, facing away from me? Bring the headpiece up for your patient. Make sure that you keep the drape going appropriately. Okay. So now I'm just going to bring you into flexion.
Okay.
Any pain with any of that?
Nope.
Nope. Can I go a little bit further?
Yep.
And any pain there?
Nope.
Nope. Okay. Having one arm or one hand kind of stabilizing above the hip and then using her thigh to move her through that. And then we'll bring her back. So Carol, any pain with any of that?
Nope.
Can I go a bit further?
Yep.
Any pain there?
Nope.
Okay. And then you'll flip them over and do the other. And then we'll end with your patient supine. Okay. Then we'll grab the leg here, just above the knee. I'm going to stabilize at your hip.
Okay.
And then I'm going to move your leg through the range of motion. So, any pain there?
Nope.
No. Can I go a bit further?
Mm-hmm.
Okay. Any pain there?
Nope.
Nope. Okay. Can you still grab onto your leg for me and clear that out of the way? Any pain there?
Nope.
Okay, go a bit further.
Mhm.
Any pain there?
Nope.
Okay. And then you'll repeat that on the other side, and then you'll have your patient already lying supine for the next portion of your exam.